Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Falls and automobile crash injuries and the late effect. This would be a very good class for your attorney or treating doctor if you've had a fall or a crash. Now, have any of you ever been in any kind of a car accident? Any kind, small, medium, large? 10?
10 accidents? I had a tiny one, but
You need a
Tiny one? How were you hit?
No,
well,
all
I was just
before I
in a
was
pickup and was
21.
back in
Or
the
by, well,
car was
no,
coming.
all the one
See,
by the time I
it just barely tapped, and she just went on. And
Okay. Never car accident? None? Okay. Good. How about a fall?
I did. I fell on the back of my head on some ice.
Okay, so what we talk about today includes all of that. And the most important reason that we're talking about this is because of the late effects of any kind of injury that occurred in a collision or a fall. I just finished seeing a fellow who fell on the steps about 4 months ago, 3 or 4 months ago, and hurt his wrist, and just came in because of intense wrist pain, and it's not getting better. And we identified why, and made a minor correction and showed him what to do at home to continue the ongoing therapy. Now, I'm going to give you some information that's not in the notes that I think is important. I'm going to name some tissue that's involved, starting with the tissue that's the slowest to heal, but the most stable. Ligaments. We talked in the past about putting a body together. If we had all 206 bones, we wanted to put together the skeletal structure, we would need about 800 ligaments. Ligaments are very tough, they're very strong, they hold bone to bone. That's the job. When you have a fall or crash, you nearly always spring the ligaments. And when I say spring the ligaments, I want you to think of, maybe I didn't do this, but I did. When I was a kid, we'd take the pins apart, springs, and we'd stretch them, and we'd never go back. When a spring is sprung, it does not go back. Ligaments are the same. So that's the top of the list, ligaments. Now we talk next about tendons. Tendons attach, tendons are on the end of muscles. That's number 3, muscles. Tendons attach muscles to bones, bone to bone. So when you flex or extend, the muscle moves and the tendons get stretched. Tendons can also be sprung. Now when I say sprung, I mean basically bent out of shape, changed in their normal alignment and normal configuration. That can occur without tearing. If you tear, it's always worse on all three, ligaments, tendons, or muscles. Then the next component are the blood vessels and the capillaries, which is the arterial side of the blood flow connecting the venous side of the blood flow. Those are always damaged. Then you have the extra drainage portion of the interstitial fluid, the lymphatic vessels are always traumatized, sometimes damaged to a great extent, sometimes just stretched or twisted. Then you have, more importantly, nerves. We have three kinds of nerves that I would like you to think about. The first kind is in the joint. Those are called proprioceptive nerve endings. You can abbreviate that by putting GPS. There are nerves that tell your brain where that joint happens to be located. Put it in. You then
Can you
have
repeat that? I'm sorry. You said-
proprioceptive
Yeah, I got it. But
GPS. So when a mosquito lands on you, you don't have to look to feel where he is. You can feel. You don't have to watch your hand go over and hit him. You can smack him because your body knows where your different body parts are.
thank you. You
So-
say proprioceptors are at the nerve? I mean, at the joints?
Joints.
I thought that they were more than just there. They're just at the joints.
Most of the joints.
Okay.
You can't wait till after class you do 5 push-ups. So we have the proprioceptive nerve endings, the GPS. We then have sensory nerves, which tells your brain what's going on in that tissue. And then you have motor nerves. The motor nerves primarily go to muscles, but they also go to skin, and they go to blood vessels. Keep in mind, the diameter of blood vessels is under the control of the nerve function. So if you're cold and you feel cold, that's sensory, your brain will tell that tissue to the vessels to dilate to give you more blood in that area. Now, when you have an injury, obviously we need a cleanup crew. The cleanup crew are we'll call them lymphocytes, white blood cells. And they come in with a number of different specialties. In the past, I've talked to you about the Army, the Navy, the Air Force, and the Marines. They all do different things. They all do different things to clean up the area. Some fight bacteria, some fight fungus yeast. Some are just looking around for any kind of problem. That's the kind of thing that Deborah looks for when she looks in their blood, is to see how many and who and what and kind of what's going on in there. So when you have a trauma, I'll call it a trauma, a crash or a fall, there's a lot of involvement.
What about having a baby? Or being pregnant, does that?
It's totally different than a crash or
It's not an impact injury.
being pregnant and having a baby is a normal, natural occurrence like digesting food.
So our daughter, she has had problems with her pelvis ever since.
Okay, so I don't know anything about the history, but often during pregnancy, especially during the last part of pregnancy, the joints loosen. In my opinion, that's the best time to realign, before delivery and after delivery. Many times delivery is hard, and they had a pre-existing misalignment, which becomes worse due to the pregnancy. And then after the pregnancy, because this was not realigned, it becomes more complicated. Now we have kind of what we're talking about, a trauma. So that kind of a birth can be damaging. I'll say it in a different way. If you had an underlying distortion, they were predisposed to injury. For example, in the class earlier this week, we had a lady who was in a car accident. She got slammed from the side. They did x-rays of her neck and said, you have significant arthritis plus a car accident. So she had a pre-existing weakness, which then made her car accident more damaging. Does that make sense? So, how long ago was the baby born?
Well, he's almost a year, but she has been going to physical therapy and they can't do anything. And
they can't do anything. Send her, let me check her, because when you have that kind of a problem, if you get physical therapy 3 times a week for 12 weeks, that's not enough therapy. The therapy for that kind of problem needs to be done 2 or 3 times a day. And where do you do that? At home. So. Yeah, but you have to know what to do.
When she was pregnant, she carried around like a gallon-sized intravenous pack because she was so sick. And I think that might have added.
Made it worse. So back to those. Now you have a kind of an overview of the tissues that are involved. Then, so after it all happens, and the lymphocytes come in to clean it up, then they do the best they can to do what my wife says at the end of the meal. We're going to clean up the kitchen because we have to cook another meal soon. So you have to clean it all up, and then you build a new meal in the new tissue. And that new tissue comes from the stem cells that are specialized. The stem cells come from your bones that you make every day, by the millions, and they come in and they make the new tissue to replace the tissue that was damaged the best they can. Now, if there's still misalignment, they can't fix it properly because things are misaligned. They always do the best they can under the circumstances. Like my friend whose wrist I checked this morning, he had scar tissue, he had swelling, but it was not healing because it wasn't straight. So the wrist was torqued and twisted. It would never have healed straight. And by the way, the same fellow told me that when he was on his mission, he hurt his ankle and it never got realigned for more than 40 years. He had pain in his ankle, his knee, his hip, his back. And then somebody, a chiropractor, helped adjust his ankle to get it realigned enough that he could heal. But now he currently has the residual effect of the compensations from the ankle. So he now has other things going on. That again, that's why we're talking about this, because if you've ever been in an accident of any kind, you fall lying on your head, you have car accidents, every one of them creates a new pattern. So that's
Dr. Smith,
kind of the overview.
also like physical abuse, like the traumatic, because it's a form of impact injury. I just know when we worked with our group home kids and who had a lot of physical abuse, I could see things in their body. Just, I mean, would you consider that the same sort of, because it is an impact injury, it's just from a different source? Plus there's more emotion behind it as well.
If a child is picked up and thrown against the wall,
Yes.
we have multiple types of trauma. For example, our daughter Deborah was driving a Volkswagen, ran a stoplight, got hit, got spun around, hit again so hard that she bent the door of a Volkswagen, which is very hard steel, bumped her head, and when she got out of the car, the lady who hit her was screaming, "My baby, my baby." Deborah thought the baby had been hurt. So she had the emotional component as well. Now I'm going to pass this around so you can see graphically an explanation of compensation. The compensation is called plastic deformation. Plastic deformation can occur in the muscles, the tendons, the ligaments, even the bones and the joints. If a joint is damaged, so what happens is the tissue changes shape to adapt to the stress. I personally had some of that happen to me as a teenager hauling hay. I hauled many bales of hay, turning and twisted. My bones in the middle part of my back from that pressure deformed. They have a name for that. It's called Schulman's disease. The bones get shorter and twist. I didn't have any idea why. I had the pain for many years. After I learned what to know, I learned that can be reversed with what's called counter-stressing. So when you do the circle slide, you're counter-stressing any kind of distortion, like your daughter would benefit from that. If you've been in an accident or fall, you help align the tissue as much as it can be aligned at that time. And then the next day you do a little more. That's why you think the words, I'm getting better and better every day in every way. So again, plastic deformation. Remodeling, that's another name for remodeling. That's another medical name for what happens. Okay, and so that's kind of the overview. Now let's go into some details on what happens biomechanically in the spine when you have a crash. We'll start out with the rear end, because a rear end crash is the worst kind that can happen. To get hit from behind. Let me give you some tips. If you ever hear a screech, become one with the car. What that means is put both feet on the floor, hold the steering wheel, push your body back in, and head back, the whole back, and stabilize. You'll have less damage than if I know there's a lot of theories, oh, he was drunk and he was relaxed, that's why he didn't get hurt. No, that's not true. You need to do one with the car. Now, I'm going to give you some more stats about when you have a crash from start to finish, takes less than 1/300th of a second. Automobile manufacturers do what they call crash dummy tests. They put a mechanical person in a car with all kinds of instruments. They have a wall, they have a car with whatever design they're testing, and the car crashes into the wall. The impact lasts 1/300th of a second. How long does the effect last? Well, you've had 10 accidents. The effect is still there. If I treated a new patient with a new accident that happened today, I would say to them, first of all, I would mentally grade the intensity of the trauma on 0 to 10. Like you're just barely hurt. We'll call it a 2 or 3. Or maybe in a 5 or 6 or higher. Let's say it's a 4. I would say to them, okay, you have about a level 4 accident. If you'd like to turn it into a level 6, then keep doing everything you're doing in your life. Staying up late, working in the yard, you'll make the negative effects of the damage greater. Now, if you want to tone it down and heal the best you can heal, then here's a note. It's a 2-week hall pass. You don't vacuum, you don't do dishes, you don't go shopping. You lay as low as you can lay to not exceed tissue tolerance, and give the body time to repair and regenerate. Now, having said that, all tissue heals better with minimal motion. Ligaments heal best with the least motion. If you know you tore a ligament, the less you move, the better you heal. Now the bad news, you can't see ligaments or tendons on X-ray. You can see the effect of a damaged ligament or tendon. If the doctor does what's called a motion study, where they take a video fluoroscopy of the motion of the neck, the back, or you do a flexion and extension and a rotation. So you put the neck or back in different positions and say, okay, when it's neutral, it's pretty good, and when you go forward, it slides. If it slides either way, then you know that something's been torn too much. The only way you can tell for certain is for an MRI. And X-ray won't prove that it's bad. An MRI does. So back to the biomechanics. Let's suppose I'm sitting in a stop sign, looking straight ahead, the stoplight, waiting for it to change. It turns green. The guy behind me is not paying attention. He's flying down the road. He sees a green light. To him it's green. Green means go. But I haven't started yet. So boom. I'm at hear a screech. If I hear a screech, what am I going to do? Become one with the car. Okay? I don't look in the mirror. Why? Because if you turn your head and you hit, the damage is much greater. Even more damaging would be if you had somebody with you, you had an old grandma with you in the front seat. You'd be the old grandma. And you. So we throw our arm over here to protect Grandpa. So you turn, you're looking up, and you hit it. Now your problem is even worse because your neck is turned, your ribs are turned, you get hit from the back.
That they're saved. No.
Really not, because then you're,
Not really.
especially if the airbag goes off, you literally have your bones are in big trouble.
No, what about, let's talk about seat rest and seat restrictions and headrest. For the least damage around town, 45 or less, seat belts loose. If they're tight and you get hit, they do more damage. When you get on the interstate, snug them tight. Why? The seat belts are designed to keep you in the car. I went to a funeral of one of my patients. They did not have seatbelt on. She was with her boyfriend and flipped the car and she got thrown out and died. Seatbelt would probably save her life. If you have same was true with the airbag.
Was that just recently?
Yeah.
Because I heard, did she work for Tuller?
I don't know.
Counseling? Oh,
I
okay.
don't know.
They both died?
Airbags can do a lot of damage,
Mm-hmm.
especially if they have glasses.
Mm-hmm.
But they save your life, they keep in the car. They do a different kind of damage. So, simple trauma, we get hit from the back, head straight, we become one with the car. Let's let this represent the rib portion of the back. The rib portion. When you get hit from the back, the car moves forward, the seat tightens up in your back, pushes this part of your back forward, fast, before the head is moved. Now something happened. When that got pushed forward, it also shoved this tissue right here up, and this tissue right here down. So you had a vertical trauma. This one pushed, let's say T7, T8 forward over T9 and under T6. That's a shearing like scissors, like a shearing motion in the disc. So that would tear the ligaments now and the joints and all the stuff we talked about. And again, the head hasn't moved yet. Then when the car keeps going forward, the head finally starts to go back very quickly. Remember, once we're into the second, the head goes back, the jaw stays level, head goes back, the tissue in the front of the neck, the chest gets tight, so tight, like a slingshot. Then this tissue then lifts the head forward. That's what they call it, whiplash. That's the old name. They call it now extension flexion injury. Jaw, front of neck, back of neck, down here, in here. Now if you run into something, you may have wrist, elbow, shoulder, knee. I had a patient who was in a collision, and the shearing action that I just told you about broke a couple of vertebrae in the back, in the middle. Cut her open, went in the front, lifted him up, put little plates on the side, screwed the plates in. She's laying in the hospital bed. After a few days, she said, my hip really hurts. well, you were in a car accident. What do you expect, you know? Well, my hip, you know, so she told him that many days. Finally, she got out of the hospital. I told her, when you get out of the hospital, stop and let me check you on the way home. She came to my office on the way home, had her come in. She looked bad. I had her stand on my scales. I had a scale that weighed each foot. She weighed 100 pounds different. She weighed about 215. She's a pretty heavy gal. I said, oh, that's not good. Where's your greatest pain? She said, I have a lot of pain in my hip. So I took her next to her standing and sitting. Her femur was broken. She had hit her knee.
Oh.
She had hit her knee and snapped this off. So I said, well, don't go home. I called Dr. Matthews, our orthopedic guy, and I said, Dr. Matthews, I'm sending her back. You need to do one more surgery. So she went back and they gave her a new hip. In the meantime, she had a lot of inflammation because of the damage. So when she got ready to go out of the hospital, she had to go to an extended care center and lingered and lingered and lingered and died within 6 months from the inflammation that was not attended to. So when you have if you ever in a car accident and the speed was low, it was an intersection. She got rear-ended at an intersection in town, so it wasn't 80 miles an hour. It was like probably 40, and just shoved her knee into the dash and broke it off. So when you're in any kind of a significant crash, keep in mind your whole body is in the car, not just the area of pain. And they always like to look at your neck first. They always like to see if there's a broken bone. If there's not, here's some pain pills and muscle relaxants. See you later. It's always worse than you thought it was. Okay, let's go to the handout. The negative effects of a motor vehicle crash. Number one, always produces more damage than first appears. Body tissue includes ligaments, tendons, muscles, and joints when strained are considered sprung and compensate. The compensation always is less resilient than the original tissue. It's called remodeling or plastic deformation. Sprung or infringed tissue always compensate at a lesser functional capacity. So underline those words, lesser functional capacity. So when they're trying to settle with you, or your friends say, how are you doing? Most of you lie. They'll say, I'm doing pretty good. I've been along okay. Do you vacuum? Oh, no, I can't vacuum. Well, you could before. Why don't you vacuum now? Well, it hurts. How about doing laundry? Well, I can't get down into the dryer. Well, you have functional impairment. Compensations are energetically expensive. That means you have to rest more and create new additional, quote, delayed onset problems. Delayed onset. That means the crash occurred this year. You might not have those delayed effects for 2 years or longer. Always consider tissue functional capacity as well as pain. Keep in mind, pain, you can't trust pain. Pain is very deceptive, but you can always trust functional capacity. Never settle a case with the insurance company or an attorney until stable and have achieved acceptable functional status. Never before 12 to 18 months. It's impossible for the tissue to heal. They like to use the words pre-existing condition. The truth is, you'll never be the same as you were before the accident. You will always have some form of compensation and weakened tissue. But if you're out of pain, they want to get rid of you quickly.
On this subject about settling with the insurance, I had a friend who worked at a car insurance company, and he would get bonuses for having somebody settled within the first 72 hours of an accident. They would actually come out to the accident and actually get there the same time as the police and like print up a check. But if they could get them 72 hours, within 72 hours of the accident, it saved the company tens of thousands of dollars of medical care. And so he would get bonuses if he could get it settled within 72 hours.
Let me tell you, even a side story,
sick.
they get a bonus if they settle within a year.
Wow.
I had an attorney for a big insurance company, which you all know, stayed in my office, right? And I was talking to him about one of my patients who had permanent impairment, and they didn't want to pay for pain and suffering and early degeneration. And he said to me, I said, you know for a fact, the way you just told me is a lie. He said, I'm talking to an attorney now. He said, oh, we lie all the time. We tell them what we want to tell them, and most of them believe us and just tuck their head and go on with life and they accept what we tell them. That's why I think attorneys need to know what we're talking about, and so do doctors. I know a number of doctors, even here in Idaho Falls, who are hired by the insurance company to do an exam and say the patient has no effects from the accident. I know personally that's true. And I know one doctor who lives in Idaho Falls who goes to California and does it in California, makes a lot of money to say to the insurance company, this patient is stable, so they can settle based on his opinion. And in my mind, that's totally immoral. We had a name for them.
Starts with an S.
What?
MS.
We call
A
them
name for them?
insurance whores.
Mm-hmm.
Yeah.
Liver shyster.
Okay, another test. Choose. When involved in any rear-end crash, which of the following occur? Always. Shearing?
Yes.
Yes. That's the sliding forward I told you about. Vertical compression?
Yes.
Yes. Stretching?
Yes.
Concussive brain synapse slippage?
Yes.
Yes. What that means, had it explained to us by a psychologist. He said in the brain we have nerves that join together with other nerves. The joint is called a synapse. When you have the concussive force, they get shifted. So the brain doesn't work quite like it used to. If you ever have any kind of a trauma, and somebody says, can you remember what happened? And you say, well, I remember them pulling out in front of me, and then I remember somebody helping me from the car. You were unconscious. That means that proves that things got shifted. Now you have what's called a closed head injury. That's a permanent problem. tissue springing, always, all of the above. Number 2, a collision takes approximately 3/1 of a second, but is not yet over for several days due to compensatory adaptations and further breakdown. True. 3, it is near impossible to duplicate the extreme motion that occurs in a crash due to both the speed and the force. True. Denise, if we hired you to come work, to participate in a test, and I said to you, okay, Denise, I'll give you $10,000 if you can move your head from here to here and back again in 3/100ths of a second. And we have the camera all set up and the timer. We say, okay, do it again. You're too slow. Do it again. You can't do it. The only way it can be done is have the crash. You can't duplicate it. Now, for generally, the greater the damage to the vehicle, the greater the body injury.
False.
That's correct. False. Why? Because when the vehicle bends, think of an accordion. And an accordion is like a cushion. Every time the vehicle bends, you're reducing the impact to the driver. It's kind of like the difference between playing baseball with a hard ball and a hard bat, and a wiffle ball and a wiffle bat. If you have a cushion, you don't get as much damage. So I remember I was in the same Volkswagen Deborah was in, and somebody pulled it out, and they pulled it right in front of me, and I hit him, and got out, looked at the front of the Volkswagen. I thought, sweet, I'm going to get some body work done on the Volkswagen. There was not a scratch, but it messed me up bad because I took all the jerk, the forward jerk. Took me a long time to get over. I had another crash. I've been in a few crashes too. I had a big car. I like big cars, and I was coming down the gravel road on the way home, and somebody ran a stop sign. I slid. I put on the brakes. I slid. Boom! Popped them. Bent their car. Didn't bend mine. And at that particular time, I was sponsoring a softball team, slow pitch softball. I would practice pitching. Yeah, when slow pitch, you have to have a 12-foot arc. You get only 2 strikes, 2 or 3, two strikes. I could throw it in the bucket over and over and over again. About 3 or 4 weeks after they crashed, we had a game. I pitched, the ball went. I thought, oh man, something wrong with my arm. I pitched another one. I had no idea where the ball was going to go. It had taken that long for my nerve in my arm and hand to now malfunction. So I said, I'm out, take me out. I can't pitch like I used to. I was done pitching because I couldn't throw the ball. My hand did not work the same. But it didn't start immediately. Okay. 5, low speed impact collision. That means 5 to 10 miles an hour. Frequently causes permanent bodily impairment, which accelerates degeneration. True. Underline the words accelerates degeneration. So when we write a letter to the insurance company, we say that due to the patient's delayed effects, they're going to degenerate faster than normal. So they can have a birthday every 6 months. They're going to get older faster because of the tissue now bent. 6, the vehicle weighed 3,000 pounds colliding at 10 miles an hour exerts 30,000 pounds pressure or damage. True. 7, usually only the neck is damaged in a rear end crash.
False.
False. What's damage?
The thoracic.
The thoracic spine, the jaw, maybe the wrists, the elbows, maybe the knees, the hips. So not just area of pain. Generally one can assume to have recovered when the pain is diminished about 80%. False.
So how do you determine recovery? Like, what is your
Definition?
Measuring device.
yes, thank you.
Okay. When I treated car accident patients, I would always use a spinal column pelvic unit, standing and sitting.
Right.
Would always do what's called the activities of daily living questionnaire. Can you
Activities of daily living.
Oh, activities.
can you wash the dishes?
Video.
Can you still have sex? Can you still do a whole list of things that you can't do now that you did before? And also pain, what is the pain when you do it? You may have no pain when you're soaking in the bathtub and hot water relaxing. But you can't sleep at night because your neck, you just can't get your neck to be comfortable, whatever pillow, whatever bed, and you never get a good night's sleep. That's a big, big deal. And the insurance company, the insurance people, they get right down to the arm wrestle with the attorneys on settling. Each of those things has a point value. So your attorney will say, okay, we've got 123 things that have now been modified. I would like you to pay my client $1,000 for each one of them. Well, that's not worth it. Well, how much is it worth? How much is it worth to be able to do your laundry? When I do the laundry, I don't get paid, but if I couldn't do it, it'd be a different story. So, any other questions? We have a couple more minutes.
So you didn't talk much about what happens to the brain in a traumatic injury. So, go ahead.
The synapses get moved. That always occurs. You may have a head trauma to the window, to the front of the face. You break teeth, shove the jaw, and have a bad jaw problem. The head may have internal swelling inside the head. It may last a short time or a long, long time. It can have a delayed effect. And again, those are the kind of things that can only be documented by an MRI and questionnaire, both of them, not just one, because you can have a normal MRI and still have functional problems. You can have a bad MRI and be doing pretty good. And if that occurred, I would expect that you would have more delayed onset conditions develop.
The brain has neuroplasticity, just like the body has plasticity.
Yes.
So you can still help your brain heal like you can your tendons and your nervous system.
Thank you for bringing that point up. You can have a tremendous amount of brain damage, and the brain can remodel.